Really anybody who's safe enough to undergo surgery. There are a few different types of penile implants that we use, and we can make the perfect choice for you. So really anyone can be a good candidate for a penile implant. Many commercial insurances cover penile implant surgery, and that's because Medicare does cover it. The private insurers typically follow in suit. But if you have a specific question, my best advice is to call your insurance company and discuss with them your policy specifically. Overall, there are two different types of penile implants. The semi-rigid, or sort of the malleable form, which are similar to flexible rods that bend up and bend down. And then there are the inflatable type. These come in a few different forms, and should be available and are most commonly used in the United States. A malleable or a semi-rigid implant consists of two cylindrical rods that go into your natural erectile space. This allows you to bend the penis up when you want to have an erection and bend it back down when you no longer want to have an erection. They do maintain some firmness or some rigidity in all positions. In contrast, the inflatable implant actually is soft and flaccid when you want it to be flaccid, and inflates to full rigidity when you desire. That gives it a little bit more of a physiologic or sort of a natural feel. Penile implants are sized specifically to your body during surgery. That means taking a measurement of the inside of your erectile chambers for the penis in the long direction and part of your penis that goes down inside you. We as surgeons like to try to do everything we can to try to optimize your penile length by measuring you perfectly and picking the perfect size in the OR. Your surgeon of your penile implant surgery will teach you how to operate your device anywhere from 4 to 6 weeks, typically after surgery. Using the device is quite straightforward. It involves pressing an inflation bulb a number of times. Each time delivers fluid to the cylinders in the penis, and then it lasts for as long as you want until you decide to take it away. Taking the fluid out of the implant just involves pressing the deflate button and squeezing of the penis. It's very straightforward, and once you get the hang of it, is easy to do on demand. Ejaculation and sensation of the penis should be the same after penile implant surgery. In fact, many men can have an orgasm without an erection. The goal of the implant is just to give you back the rigidity that you need to have sexual intimacy as you desire. However, it's important to know that some of the conditions that lead to erectile dysfunction, like diabetes, can cause changes to sensation and ejaculation. But nothing about the penile implant should change you from your baseline. Inflatable penile prostheses or penile implants are very well concealed. They appear very, very natural, and no one should be able to tell that you have one. If you were to be at the health club or the gym or camping, no one should be able to tell that you have a penile implant. The Coloplast inflatable penile prosthesis is made out of a material called BioFlex silicone. This is specifically engineered for penile implant use. The fluid inside the implant that moves from the reservoir into the penile cylinders to get you erect is just saline, so salt water. That means that if anything were to ever happen, you wouldn't be at any risk if the fluid were to leak out. For most men getting a new penile implant, the procedure is very straightforward and minimally invasive. It's about a 1-hour operation under general anesthesia. I typically make a single opening, either at the top of the scrotum or right on top of the penis, to insert all of the elements of the implant. That includes the reservoir, the cylinders, and the pump. I size the device specifically to your measurements so that I can optimize and maximize your length. You then wake up in recovery and are able to go home the same day. Duration of recovery can vary quite a bit from man to man, just like everyone's pain threshold varies. Most men are sore for the first 2 weeks of recovery. By 4 weeks, I would say 99% of men are feeling great and ready to activate their device. The vast majority of men can use their implant at about 4 weeks after surgery, so it's a very rapid recovery. You see me on that visit and I teach you how to use it. Make sure you're comfortable with both inflation and deflation, and then you're free to go. Inflatable penile implants have been around since the early 1970s. In fact, in 2023, they celebrate their 50th year on the market. In that time span, the duration of longevity of the devices has improved drastically. We know that now 2/3 to 3/4 of implants last over 10 years, which is more than most mechanical car parts, for instance. So they have a very, very good lifespan. The vast majority of men, about 85% or so, are very satisfied with their implants. We know that drivers of dissatisfaction are things like not having a partner or losing a partner. But other than that, most men are very satisfied with their decision and with their implant in general. There are some risks to having a penile implant and to penile implant surgery in general. 2 of the major risks are things that are sort of inherent to any mechanical implant that we put in the body. The first being infection, so the implant can become infected. In a non-diabetic patient, the risk of implant infection is about 1%, and just a little bit higher for diabetic patients. The other inherent risk is just mechanical failure. And as I mentioned previously, the risk of that occurring is low until about 10 years. We know that 2/3 to 3/4 of implants last over 10 years, so very, very low mechanical failure rate. Other potential risks are surgical risks, so injury to the structures I'm working near, including the urethra, bladder, inside the pelvis, or misplacing the implant. That's one of the best parts about going to see a penile implant specialist. The rates of those kind of injuries and issues is significantly lower.